Thank you, Jodie, and thank you everybody for coming today. Thank you, Uncle Alan. So, Love and Kisses, Taking Action. This is a plan that's based on human rights, and those rights have been drawn from the United Nations Convention on the Rights of Persons with Disabilities. So, as many of you here would know, Australia signed up to that convention in 2008, and that means we have an obligation to have laws and policies in place that uphold people's rights. The convention is very much about people with disabilities being able to make their own decisions about the lives they lead and having the same choices that everybody else does. So this is our opportunity to put into action the broader statements made in that convention. So the convention has 39 articles, and they apply to lots of aspects of life, including childhood, women, equality, discrimination. But we've focused on really 5 in this plan that relate particularly to reproductive and sexual health. And so Rob and I together will be taking you through those along with a couple of our guest speakers. Okay. So firstly, I would like to talk about Article 16, an important article that states that people with disabilities should be free from exploitation, abuse and violence. That's a right. How could we argue with that? But yet we know that people with disability are much more subject to violence than people without disability in our community. Women and girls in particular are subject to sexual assault much more than women without disability, and this occurs across the lifespan and can occur repetitively. So a serious problem with many causes, but unfortunately the response to that has been very slow. So what we say is needed is a workforce that is knowledgeable about the consequences of violence, can recognise violence when it's occurring, and is skilled at responding or preventing it. But the workforce can only be as effective as the environment in which it works in, so it's important that our health system, our disability organisations, our judicial system work together to be able to provide a coordinated approach that responds to people's right to be free from exploitation and violence. And in addition, people with disability have a right to education, the ability to be able to make decisions that can keep themselves safer, and to particularly understand their rights to not be in exploitative relationships. This is a quote from Louise, who is one of the people who speaks in our very good DVD that was released a few years back called Love and Kisses. And Louise says in that DVD, people with a disability have a right to sexual relationships together, and to go out together and to enjoy life.
I'm going to talk about Article 23, which is respect for home and the family. So this article states that people with disability have the right to retain their fertility on an equal basis with others. This includes the right to decide freely and responsibly on the number and spacing of their children, and have access to age-appropriate education and reproductive and family planning education. The recent Senate inquiry into the involuntary and coerced sterilisation of people with disability highlighted just how far we have to go in upholding these rights. Family Planning New South Wales supports the rights of people with disability to have children and families. We need to work towards eliminating discrimination for people with disability in all matters relating to marriage, family, parenthood and relationships. To further explore this area, I'd like to introduce our first speaker, Robert Strike. So welcome, Robert. Thanks for joining us today. So let's keep going. So Robert, you're a pretty familiar face around here at Family Planning New South Wales. I think a lot of people will recognise you today. We have your poster up there, and your posters have been adorning our walls around here for a long time and been sent out. So thank you for coming back and joining us. But for people who don't know you so well, can you just start by just telling us a little bit about you?
I don't like men who eat these. I have hypercephalus. It means water on the brain, and weak fingers, my teeth powder, and my eye was down here. So I was born with it. I was brought I was home most of my life till I was at age 3.5. Then I went to an institution. And then 1975, I got introduced to my family. There's one too many whites around here.
I think we're all good to go now.
All right, okay.
And you also had a stroke a few years ago, didn't you?
2 years ago.
Yeah. And how has that affected you?
My speech was, you couldn't understand me. My walking, I was hopeless. My right side went numb. And I had help to try and make certain I did my exercise. Now I'm taking tablets, which I hate.
So the poster was taken about 12 years ago, so
Yes.
a fair bit of time has passed since then. Take us back to when the poster was taken. Why was it important for you to be in the poster?
I think we decided to do the poster because Julie and I talked about it, and then the family planning asked us to be the photo. Our kids are not that age now. They were 10, 8 and 4, I think, back then. So now Manny's is the one on this side. She's 22. Bradley's going to be 21, and Cassie is 18. They will me. I don't will them. That's part of life.
Yeah.
All parents put up with it. They tell you what to do. They don't let you tell them what to do.
So, what else has happened since the poster has taken? What are your children up to now, and how are your relationships?
Up to no good, like everything else. The kids, Manny's doing a university. Bradley's doing cooking, but he's working at Costco's, or whatever they call it. And Cassie's working at Charlotte Workshop. Started today. Yeah. So, and they're doing fine, as far as I'm concerned.
Yeah. So they're doing great. Back when you decided to have children or first had your children, what did other people say?
If I remember, the rumours were going around Julie was pregnant.
Mm-hmm.
And we wasn't quite sure, so we went to check it out, and it was true. And then we talked about it, that we will have the child, because I don't like the idea of abortion. I never have, I never will. But it's up to Julie to decide as well, because it's her body, not mine. Every person should respect a woman's prerogative to have children or not. And I think that was okay with me.
And was everybody supportive? I think you were telling me earlier not everyone was supportive. You had
No.
some fairly negative things said as well.
There was rumour going around the conference. We had a conference in Sydney here, and they were talking about child Julie's like upsetting Julie and stuff, and saying that you have to be able to bring up children, and they told us that it's a child having a child. They told them we will prove them wrong, and we did.
You certainly did. So there were others around that didn't support that right for you to have children, and in fact said it was like children having children.
Yes.
How did that make you feel?
Angry.
Mm-hmm.
I always look at it, I like to try and prove people wrong in a big way. And we did. We got 3 lovely, beautiful children. Well, they're not children now, they're teenagers, old enough to tell you what to do, which is natural.
So along the way, what helped you in raising your family? Were there particular people that gave you a hand?
Oh yeah, Julie Auntie Faye, and she was very good, very helpful, very, she looked after the children and she helped us a heck of a lot. And then we had people coming in talking about Cassie and stuff like that. So, yeah.
So there were other services that supported your family as well?
No, they didn't support us. They just talked to us about different things.
Mm-hmm.
And we had, Cassie was a young lady who needed a lot of work. And Julie and I had to make certain it was clean and stuff like that, things like that. That doesn't weigh me now.
So what would you say to people that didn't believe that you could be a parent? What would you say to them now?
They can jump in the lake. The first thing that I would say, the people should be able to have children if they want to, but once they have the necessary support and the education around bringing up children. It's not easy to bring up children. It's not easy to be a parent. We did a good job. Julie and I have done good with our children, and I think it's the way they are now. They're good, as far as I'm concerned. I think if there's training around for people who want, people with disability who wants children, they need to make certain they are working together as one, not them and us. And that's what I don't like. It's not them and us. We work together as one.
As a team.
Yes.
Well, thank you for joining us today, Robert, and sharing some of your story. I think you've certainly proved a lot of people wrong along the way. And yeah, just on behalf of Family Planning New South Wales, thank you for participating in that photo 12 years ago. I think we've certainly got a good run out of it over the years, and I think you've told us it's about time we update it.
It needs to be updated.
Yeah, we think we need to update it.
Because it's gone now.
It's something that we're looking into. So thanks again, Robert. Please join me in thanking Robert.
No worries.
Thanks very much, Robert, and thank you, Rob. So I'll move on now to talk about the next area of rights outlined in the Convention, and that's the right for people with disability to be able to access affordable and quality health services, and of course that includes reproductive and sexual health. Despite this right, we know that people with disability have much poorer sexual health outcomes than other people in our community. We know that women with disability aren't accessing screening services such as for cervical cancer or for breast cancer. We know that people with disability are at just as much risk of getting a sexually transmissible infection, including HIV, as anybody else, and yet we don't know whether they're accessing testing and treatment. Women with disability who want to become pregnant or are planning a pregnancy aren't always receiving the support and information they need. And doctors are reporting that they don't always feel comfortable addressing the sexuality issues of people with disability. So, why is that happening? And, really an important part of this is that common stereotype that people have of people with disability, that they're not sexual beings and don't have a sexuality. And this really negatively impacts on the type of services and supports that are provided to people. People aren't being provided with the information and education they need to be able to make the decisions that can help keep them healthy and to be able to make the decisions that will best support their own lives.
Article 24, Education. This article recognises that people with disability have the right to education without discrimination and on the basis of equal opportunity, ensuring an inclusive education system at all levels. People need to learn life and social development skills, including sexual health and relationships education, to facilitate their full and equal participation in education and as members of the community. The myths that surround the sexuality of people with disability serve to justify these denial of rights. People with disability have been denied sexual health and relationships education because it has been assumed that they are asexual and therefore will not need this information. They may also be stereotyped as oversexed or deviant in their sexual behaviour and therefore denied education in order to not encourage or suppress their sexual expression. Sexuality is a lifetime of learning. Ideally, education should start at a young age and continue throughout the school years and into adulthood. It needs to be supported by people who recognise their rights, have the knowledge and skills to provide comprehensive sexuality, health and relationships education. It is therefore the responsibility of parents and carers, schools and teachers, and disability service providers to ensure appropriate education is provided throughout all life stages. Education is the key to addressing many of the negative consequences people with disability face around their sexuality and is crucial in all efforts in upholding these rights. Research has shown sexuality and relationships education builds knowledge and self-esteem, increases skills and community participation, and improves decision-making skills. Building capacity in these areas has also been shown to reduce vulnerability to sexual abuse and build self-protection skills. A recent consultation by Family Planning New South Wales with service providers demonstrated this point. Disability organisations want people to have a good life, but based on what they think is a good life for people with disability. Supporting sexual expression for people with intellectual disability looks pretty radical to service providers. They grapple with their role to support people with intellectual disability in their sexuality. The next article is Article 21, Freedom of Expression and Opinion and Access to Information. This article states that all appropriate measures should be taken to ensure people with disability can exercise the right to freedom of expression and opinion, including the freedom to seek, receive, and impart information on an equal basis with others. We already understand the many barriers that exist in society to accessing appropriate and accurate reproductive and sexual health information. People with disability have additional barriers to accessing this information. The article states that information intended for the general public needs to be provided to people with disability in accessible formats and technologies appropriate to a range of different types of disabilities and in a timely manner and without additional cost. Family Planning New South Wales develops a range of resources around reproductive and sexual health for people with disability. We recently released All About Sex, a resource of 19 fact sheets written in an easy-to-read style and with colour illustrations to support people with intellectual disability and people with low literacy in learning about sexuality in relationships. It covers a whole range of sexuality topics, from learning about men's and women's bodies through to puberty, menopause, sexual assault, sexual relationships, and so on. You can have a look at All About Sex in the break. Our bookshop will open, and you can also have a look at our full range of disability resources too. Upholding this right also needs to recognise the diversity of people with disability. Information needs to be culturally sensitive and appropriate for Aboriginal and Torres Strait Islander people, and also people from culturally and linguistically diverse backgrounds. A current project at Family Planning New South Wales addresses the needs of lesbian, gay, bisexual, transgender and intersex people with intellectual disability. A working group has been formed to develop resources, organise social events to reduce social isolation, and a photographic exhibition to raise community awareness, and which will be launched as part of the Mardi Gras Festival in February. Yeah, and we have a few members of the LGBTI working group with us today. And this is a photo of just some of the members who've been involved with the working group over the last few months.
So just to finish up from this part of the presentation, I just would like to briefly cover the themes of the areas that we want to take action in according to our plan. The plan provides all the information and a lot of detail about actions, and you'll be able to read those later. I'd just like to briefly summarise the 5 sort of key themes that cut across all of the issues that are raised in the plan. The first one is about government, the need for government to have inclusive policy, inclusive strategies that recognise the reproductive and sexual health needs of people with disabilities. As we've mentioned before, too often they're very silent on this part of people's lives. And in particular, the new National Disability Insurance Scheme needs to recognise that relationships and reproductive and sexual health are aspects of people's lives that are as important as any other. Laws need to be reviewed and changed to make sure they reflect the United Nations Declaration on the Rights of Persons with Disability, and in particular that they uphold the rights for people to make their own decisions. We need better research on the sexuality and relationship needs of people with disability. The research agenda needs to be prioritised so that people with disability are more represented. It's only in this way that we can have really well-informed policy and good service development. And that includes the need for better data collection as well. We really don't know what's happening for people with disability in relation to sexual and reproductive health, really beyond our own practice and some limited evidence. We also need to prioritise education. People with disability having that right for education through schooling and right through in their adult years, and the importance that plays in people being able to make their own decisions. We also need their education to be supported by support workers, by doctors, by health professionals who have a positive approach to their sexuality and open up doors for questions, refer people on to services as needed, and most importantly, create social networks where people can actually start to form relationships with people. We need training for professionals, for doctors and others, for teachers, support workers, other clinicians, so they know how to uphold the rights of people with disabilities and how to support their relationships. They need to be better skilled at being able to assist people in making their own decisions. And the 5th area, which is by no means the least, is supporting parents and carers, giving them the resources, the ideas, the information that they need to support their family member, to have healthy relationships, to have a safe sexuality, and to be able to make the decisions that are right for them. Thanks very much.